So good morning, everyone, and welcome. My name is Lean Fox, and I'm a partner at KPMG, and we are delighted to be supporting IT at Cork with this tech talk on AI technology. I suppose a few years ago, AI was just a buzzword, but today AI is transforming industries, from the automotive industry with self-driving cars to healthcare, where AI is already seen as a game changer, with virtual doctors and robotics in surgery, to name just a few areas where AI is really making a change in healthcare. And really, I suppose AI is increasingly becoming a large part in our day-to-day lives, from Google searches, where AI is working behind the scenes to help us find whatever it is we are searching for in Google, to Google Maps that is notifying us of traffic delays on our way to the office, to banking, where I suppose AI again is just monitoring our account and will, alert us to any activity that is outside of the norm. So AI is, really changing the way we live today, the way we work, and the way we do business. This morning, we have a really exciting lineup of panelists, and I am thoroughly looking forward to hearing their insights on developing AI technology. Before I hand over to our MC, James Sugru, I would like to share with you that at KPMG in Cork, this year actually marks our 50th year in the city, and we are planning for the next 50 years. In particular, we know that the tech sector will be instrumental to the future success and growth of not just our city, but of our region. We are really fortunate here in Cork, and indeed Ireland, to have such a thriving tech industry. To recognise Ireland's emerging tech innovators, we're really proud to launch the second year of the KPMG Global Tech Innovator Competition. So we're on the search again. We're on the hunt for the next big thing. Our competition is now open, and we're seeking entries from innovative Irish companies with a chance to win locally and represent Ireland at the Global Tech Competition, which will be held during Web Summit in Lisbon in November. So if you're a tech entrepreneur, we certainly want to hear from you. To learn more, simply Google KPMG Global Tech Innovator or reach out to myself or Kieran. And now I'm delighted to hand over to James, who will briefly introduce the panel and kickstart the discussion this morning. James.
Sorry. Thank you, Celine, for that. Great introduction. And yeah, no doubt Cork has the next big thing, because, we're always punching above our weight here. So great to hear about the competition. I'm sure there will be Cork entries there in Web Summit representing. And welcome everyone this morning to today's Tech Talk. I'm James Sugru. I'm Software Engineering Manager at Zazzle, but it's not about me at all today. It's about our panelists and how they've developed AI applications. So I think, it's great. The use cases in AI, that Celine just talked about there are fantastic. And Cork is far from being left behind. You'll hear from our panelists today, and we've got some great AI startups and scale-ups in Cork with Altada and Kilvar. So today we'll be talking to our 4 experts about their experiences developing AI applications, and each of them will have between 5 and 8 minutes talking about their own area. And then at any time, please do ask questions in the Q&A box down there, and I'll field them to the panelists as we go through. So we're going to be starting with Barry O'Sullivan. Barry is professor at UCC and founder and chief AI officer at Stimul.ai. Barry, you'll tell me how to pronounce that correctly. So I'll hand over to Barry now, and he'll talk to us about what he's been doing.
Sure, great. Thanks very much, James, and thanks for having me here this morning. So I was asked to give an overview of AI, just kind of set the scene, which I'll do, and just I suppose a few comments about Stimuli. So Stimuli is a new UCC startup. It's basically a strategic planning tool for the health service to help minimize waiting lists. And so at the moment we're doing a lot of work in the UK and in Northern Ireland and in Canada. Hopefully soon getting something off the ground with the HSC in radiology. But the CEO's Niamh McElhatton, a very really excellent CEO from the north of Ireland. So you'll be hearing more about us, I hope, in the next while. I guess just to set the scene, and I suppose something that everybody here should be aware of, there's a lot of work being done on the ethics of AI systems, and I suppose that's resulted in a new regulation coming from the Commission on AI, which I think if you're not aware of it, it's important that you are, especially if you're associated with a company or a product that's AI based. So I suppose, where does AI come from? Well, in 1956, the term was coined for the very first time. So since then, people have been working on artificial intelligence as a field, although people were working on the kinds of ideas that underpin AI before that. And back then there was this ambition that they could, essentially solve many of the aspects of AI, many of the aspects of human intelligence in about over a summer. But obviously there was a lot of things that they didn't know at that point, which we can discuss later. I suppose, what is AI? Funnily enough, there's no definition of AI. AI as a field is a bag of different areas. So machine learning, natural language processing, planning, vision. So essentially, it's all about trying to automate or build computer systems that perform tasks that are normally regarded as requiring human intelligence. So, for example, if you think that translating one language from another normally requires human intelligence, then there is surely an artificial intelligence system that is there in the background doing that task for you. And I suppose it's important to distinguish between AI methods and systems, because I suppose from a commercialization point of view, methods are not regulated, but systems are. And I suppose that's really, really important. And it's also important to realize that the ethical issues kind of arise when the technology meets use. The technology itself is not unethical. It's when it is used in some particular way, that's when the problems arise. And as we've heard, AI is all around us in all sorts of ways. I suppose there's a lot of hype around AI, which is unfortunate. So there are lots of companies making claims about AI that just simply are not true. LinkedIn is a particularly bad place for hearing about these types of things. But behind the technology, there are some real success stories and some real innovations. And I think that the technology is certainly here to stay. I think it's really going to become the next core component of information technology that we will probably be using for the rest of our lives and developing as significantly as possible. I suppose over the last number of years, as I said at the beginning, there's been a lot of work on the ethics of artificial intelligence. So the European Commission put together a high-level expert group in 2018 to look at a set of ethics guidelines for trustworthy AI in Europe. And I suppose this was a group that I was very fortunate enough to vice chair. The chair of the group was Pekka Lapitala, who was the former president and CEO of Nokia Mobile Phones. And we brought together representatives of industry, a variety of different sectors, from academia, from civil society organizations, from advocacy groups, 52 people in all. And that group really looked at what should ethical AI look like in Europe. And you might wonder, well, isn't ethical AI the same everywhere? And so very quickly, the answer to that question is no. If you look at something like the Modern Machine experiment, which is an MIT experiment where they look at trolley problems. So, you get examples like this. And basically, you work through a series of 13 scenarios. So you can go to the Modern Machine experiment and do this yourself. And you have to make these decisions, So, these are self-driving car things, which, there's some problem with the car. And so do you let the car continue, or do you ask the car to go in a different direction? And depending on which scenario you choose, there's a different impact on human life. Now, of course, we don't tend to make life or death decisions on a daily basis, but we do tend to make safety decisions on a daily basis. So, if there's a cyclist on the road, do we drive a little bit closer to that cyclist to try and dodge that car, or do we drive closer to the car to save the cyclist? These types of things. And what's interesting is that if you look internationally at the responses, sorry, 1 second, I think I've gone ahead by one. Yeah. So if you look ahead, if you look at the responses, you find that there's a particular sort of pecking order to how people prefer to save certain types of people. So on the right hand side here, you see all of the different type of participants. So, we really want to save strollers. So we really want to save babies. And we really want to save girls more than boys, but, similarly. But we're happy to sacrifice cats, then criminals, then dogs, which is kind of interesting. But what's really interesting is that when you break this out geographically, you tend to find that the preferences of people, or I suppose the ethical principles of people, do break out culturally. And so this is a dendrogram. This is a sort of a similarity visualization of countries that are similar. So, for example, Ireland is up here in this group here, and we're quite similar to other sort of Western countries. When you break that out by preference, you find that there are really different preferences between the southern parts of the world, eastern parts of the world, and the western parts of the world. And so there isn't a universal ethics for artificial intelligence. That makes developing sort of trustworthy and ethical AI quite challenging, because what people consider to be acceptable and ethical is very much a cultural thing. So in 2018, we released the ethics guidelines for trustworthy AI, which are now official EU policy. And these sort of set out 7 key requirements that AI should have. So AI systems should protect human agency and should be subject to human oversight. They should be robust and safe, and a number of other things, which we can go into in greater detail later on. But they're the kinds of things that I suppose that we would expect of AI systems, so that they avoid, that they are fair, that they avoid discrimination, and that they promote diversity and things like this. Interestingly, if you look at the ethics guidelines through the lens of personal data in the GDPR, you do see these principles in the GDPR, which is interesting. We didn't set out to do that, but it ended up that way, which is interesting. At Insight, for the Commission and with the Commission, we've developed an assessment list for trustworthy AI. So if you're wondering, how would we sort of assess our own systems, you can take a look at this website, and there's sort of a prototype assessment list for what one might sort of look at and what kinds of things one would consider in evaluating an AI system. So I suppose, where is this going? And we come back to this later at the end of the session. The Commission have proposed a regulation on AI, which some of you might be aware of and some of you might not. This is an extremely important piece of regulation. Given the ubiquity now of AI systems, it's a risk-based piece of regulation. So basically, AI systems will be categorized by the risk that they pose to the fundamental rights of citizens, but also the risk that they exhibit from a robustness point of view. So is there a risk that the system doesn't do what it's supposed to do? And taking these 2 dimensions, there are these 4 levels of risk. It's interesting what the Commission are planning to, I suppose, prohibit in Europe, but also what's particularly interesting, I suppose, what systems will be high risk, because these will come with significant obligations. And so just to give you a very brief whistle-stop tour, we can come back to this later. And so there's a little delay. First of all, most AI systems will not be categorized as high risk. And so these will come with sort of transparency obligations. So basically, people will have to know that they're interacting with an AI system. And there'll be voluntary codes of conduct. But there are other systems that will be considered high risk. So things like medical devices, the things that impact people's employment, recruitment, and things like this, law enforcement, all these types of applications. And so these will have very significant requirements associated with them. And there will be some systems that will actually be banned entirely. So things that create hallucination in the elderly or the vulnerable. So those that exploit children and so on. And general purpose social scoring, such as that's in China, that will be banned in Europe. And remote biometric identification. So things like facial recognition on the street. So many of these types of things will be banned. And so it's interesting to consider this, because obviously this will be coming at you down the track, and we'll be happy to talk about this later on. And it's been a real pleasure giving the opening talk, and we'll talk more later. Thank you very much.
Thanks a million, Barry. That's brilliant. I didn't realize the regulation had that much detail already. So it'll be interesting to go into a little bit more and see how maybe even the different topics that we've covered here, how they'll get impacted by this regulation. So thank you, Barry. So next up, we have Geraldine Boylan, a professor at UCC as well, and co-founder of Surgenex. So hi, Geraldine. Maybe you can give an intro and talk about your stuff.
Hi, thank you, James, and hope you can hear me okay and see my slides.
Yeah, perfect.
Great. Okay, look, thank you very much for the invite to talk this morning. And I'm really delighted to be here because, and to pick up on a lot of what Barry has said, is all of this was, when we were doing our original trials in AI in newborn infants, a lot of these regulations and obligations didn't exist. So it's really nice to see now that there's a framework in place and that we have these guidelines, and I'm sure there'll be lots of discussions later on this particular matter. So I'll just move on here. So I want to tell you a little bit about, just set the scene. Infant is based right here in Cork. Here in Wilton, we have and UCC. So it's a translational research centre. And what that is that it's a centre that's focused on improving health outcomes during pregnancy and for newborn infants and for children, but through innovation. So we're very focused on making sure that whatever we do reaches the patient population that we are trying to improve the health outcomes for, i.e. pregnant mothers and children. So innovation is really important. We have a multidisciplinary team, a large range of healthcare professionals, engineers, data scientists, computer scientists, all working together to solve problems in this particular area. And why do we do it? Well, because even today, so many pregnant women die during labor or earlier. Newborn infants, and that's infants up to the age of 1 month, that's the sort of population I'll be talking about in this talk, still die today. A huge number in low to middle income countries, but still an awful lot in high income countries and right here in Ireland. And the numbers really are a little bit static at the moment. We're not moving the dial. And I think a lot of this is because we've gotten so far, but when it comes to getting the information that we need, we have to realize that one size doesn't fit all, is that we need to develop drugs and technologies for this population, for children, for babies, for pregnant women. And as you probably know, a lot of trials that have been done before have been predominantly done in adults. And what we found is that the drugs that we use to treat newborn infants and children have never been tested in that population, because what we did was we took the drug and we just gave a smaller dose in a child or a baby. So 50% of the drugs that we use in children have never had a clinical trial in children, and it goes up much higher in infants, 90%. So that's one of the reasons why we're really working in this space, and clinical trials are a big part of what we do. But of course, medical devices are a little bit behind the clinical drugs framework. So what we want to ensure is that we use the right technologies for the right population at the right time. So at Infant, we're very much focused on looking at what is healthy pregnancy, healthy newborn infants, but also those infants that have problems, and how can we help? And I just show you this picture, and I want you to look at this newborn infant who is sick, who's on the intensive care unit, and these are the kind of infants that are in our intensive care unit right here in Cork at this moment. And we monitor lots of their vital signs, their blood pressure, their heart rate, their oxygen levels. But the thing we can't do is ask that infant how they're feeling. Is there anything else that we should be doing? So clinicians are sometimes working in a little bit of a void. They need more information about those infants, and particularly they need it quickly. So we've always been thinking, well, how can machine learning, artificial intelligence help us to get more information about this population, so that we can then act quickly, because we know that if we treat infants early, if we know what the problem is quicker, treat early, the outcomes will be better. So we've been working for a number of years now, because we've been very aware of the information that is in an neonatal intensive care unit. And I have to say, I'm focusing for this talk on one particular aspect of the work that we do, which is in newborn infants. But we're using AI and machine learning in lots of other areas of the sort of the problems that we try and address at Infant. So one area that we have focused on is the area of newborn brain. We need to monitor the brain of newborn infants in intensive care, because they are susceptible to brain injury, unfortunately. And we can do that by putting little sensors on the baby's head, and that will give us a lot of information about the brain health of that newborn infant. But unfortunately, we don't have experts available to interpret that. It's a complex signal. So we don't have those experts available 24/7 in our neonatal intensive care unit. So we've been really sort of focused on how can we use machine learning to be that expert. And when I say we've been focused on it, we've been focused on this for many, many years. And so we looked working with our machine learning experts, our engineers at UCC. We've developed a machine learning algorithm for actually interpreting the brain activity of newborn infants. But in particular, one of the key things that happens to a newborn infant when the brain isn't so well is that they have a seizure. Now, if you or I have a seizure, an epileptic type seizure, we know about it. Something happens, it's obvious. But when that happens to a baby, we don't see anything in the baby, they don't do anything, they can't tell us there's something wrong, and they don't always move because they have a really underdeveloped neurological system. So this is where machine learning can really help, because we can take that information about the function of the brain and we can ask AI to be that expert at the cot side for that newborn infant and to alert us when there's a problem. So with Liam Renan and Gordon Lightbody, who've led our engineering team at UCC, we developed a machine learning algorithm that would provide an alert for the healthcare professionals at the cot side of newborn infants to tell us when there's a problem. But of course, we knew that in order to, so we developed this algorithm for a long number of years, and we had lots, and thanks to the amazing contributions of all the families in Cork and actually across Europe as well, we were able to use that data to test, to train, and to validate the algorithm to detect neurological problems. But we knew we'd have to do a randomized controlled trial to get this clinically accepted and also to make sure it worked. And I should say that all of these studies that we did, we had ethical approval from all of the families and to use this data and to use it later if we needed to commercialize this so that babies would benefit worldwide. Well, we did a randomized control trial a number of years ago now across 8 maternity hospitals in Ireland and the UK, the Netherlands and Sweden. And what we found with that algorithm that was developed right here in Cork was that it works better than the human at the cot side, because we could detect more seizures if this algorithm was running at the cot side. So what we did was we did a trial of monitoring brain activity. And in one arm of the trial, half of the infants had monitoring with algorithm. The algorithm system was also running alongside the brain monitoring, and in the other arm it wasn't. So we detected a lot more problems in those infants when the algorithm was available for surveillance than in the arm where it wasn't. So this immediately proved that this actually works. And we published this in a Lancet journal. It was the first trial of an AI system for newborn seizures. And an editorial that was published at the time, and I think this is important for what we do. You know, the editorial said that we do fear machines that they'll replace doctors, but I don't believe that. I think used in the right way, machines will empower doctors. Particularly in critical care settings, but in lots of other settings as well. And this is just one very specific example of where artificial intelligence can really help. Because the thing about monitoring newborn infants, it's 24/7. So we need, if a human is looking at all of this information, and there's vast amounts of information, and to process all that quickly, to act fast, that's a challenge. But not so much for a well-trained algorithm. So therefore, what we're finding now is that there are so many more ways that we can use the data that we acquire to help us. And it's to help. It's not to replace the clinician, but it certainly will provide another piece in the puzzle to make treatment decisions faster. So what we've done now with that algorithm, it's been commercialized. The first to a commercial company, Neon Coden, that's based in Japan, but they have patient monitoring systems. They've integrated this algorithm into their machine so that now any neonatal unit that is using this brain monitoring system has access to the algorithm. So it's translated. This is what we want. We want to translate the technologies from the bench. In our case, people say to the bench side, but we say to the cot side because that's the population we serve. But to finish, we have a lot more to do. And I hate these headlines because we see them far too often, where for whatever reason, for complications or for no apparent reason at all, a baby will have had a difficult journey during birth, during labor, and a baby is brain injured. We would like to use now artificial intelligence to help prevent those injuries happening. And we strongly believe that we can. And our latest project is called AI for Life. And we're using what we're doing is using artificial intelligence to monitor the fetal heart rate during labor to alert us when there's a problem. We've a lot of work to do in this space, and I know I don't have time to tell you all about it now, but there is a Science Foundation Ireland sponsored a little small video about this technology, and you can Google it on, it'll come up as AI for fetal well-being, but it tells you a little bit about our plans to use AI to identify the baby who's in trouble during labor and needs to be delivered faster. So just to end, to say that I'm really proud to say that because we have so much to do in this space, our first spin out from the Infant Research Centre is a company called Surgenics, which I co-founded with colleagues, and we're really focused on innovation in brain monitoring technology, because the one thing we do know is what we have to do is we can't wait much longer. Babies, quite frankly, they've been waiting far too long for AI in my mind. So we need to speed up the translational process. And the best way to do that is with commercialization. So I leave it there, but I do want just to say we have a fantastic multidisciplinary team at the Infant Research Centre and fantastic staff at both the Cork University Hospital and the Maternity Hospital. Our research and innovation support at UCC are second to none. But most importantly, the families who participate in these studies, we couldn't do what we do without their participation. So thank you for your attention.
Thanks a million, Geraldine. It always blows me away what the guys in the infant research team are doing. It makes me feel completely inadequate sitting in front of a keyboard when you're there actually genuinely saving lives and doing great things with AI. I love how you're able to get all of that data gathered and stuff. It's fantastic stuff. So just a reminder, everyone, if you do have questions, just throw them in the Q&A box and I can get to them after each panelist or at the end. So next up, we have Paddy O'Connell, CEO at Berkeley, and he'll be talking to us about how AI is used in the recruitment sector.
Morning, everyone. Thanks, James. Hope everyone can see the slide there. It's a hard task to follow on from Geraldine and, as you said, James, all the good work that's been done in the Infant Research Centre around baby brainwaves and fetal heart rates, but I'll do my best. So maybe just to, I suppose, take an opportunity really just to kind of give an overview in terms of how AI is being applied in, I suppose in the, Barry mentioned certain industries where AI is being applied in the whole area of robotics and whatnot, and obviously Geraldine focused on the whole area of infant research. I'm going to dumb it down a small bit and talk about the more mundane things and that being recruitment. So I suppose Berkeley, just a small bit about Berkeley. Berkeley have been in operation for 25 years. We're a recruitment partner to many organizations across Ireland, work with candidates and clients and trying to find the best fit. And obviously, I suppose our whole job is about successfully aligning talent to candidates, to client requirements, etc. We've three main divisions that we work with. We work within technology, we work within life sciences, and we work within supply chain. And I suppose our sector would be very labor intensive. And what I mean by that is in the sense that I'm doing recruitment 20 years. When I started off in recruitment, we would have focused very much on using the likes of Boolean search to interrogate databases and, I suppose mine data coming out, mine candidate data coming out of the likes of job boards. But invariably what that would have meant would, particularly in the tech side, I think you would have required maybe a consultant that would have had a knowledge of technology, that would have had a good knowledge in terms of markets, the skill sets required in technology, etc. Right? And also had that ability to construct complex and long Boolean search strings to be able to interrogate that data, the databases as well. So in 2018, we looked to, I suppose, finalize a strategic partnership with a AI and machine learning talent pooling platform called Elevate Direct. And Elevate Direct, essentially what it does is it allows the use of AI and machine learning to create dynamic talent pools of talent by, I suppose, utilizing AI and machine learning to actually automate the whole area of recruitment. And that's particularly around the whole search and selection piece. So we finalized that strategic partnership in 2018. And I suppose people talk about the likes of Industry 4.0, you know, the use of the increasing use of AI and machine learning in the whole area of IoT, cloud, cyber, etc., robotics, and the whole area of, you know, the smart manufacturing or whatnot. So we'd like to call it recruitment 4.0. And, you know, as was mentioned earlier about synergies, right, between, I think Geraldine mentioned about the use of AI, you know, is it going to do away with doctors and whatnot? No, it's not. And obviously in the same way, the use of AI is not going to actually do away with the likes of recruitment, but it's actually going to empower recruiters to actually create an even better experience for both candidates and clients. So maybe just to give you a small bit of an overview in terms of, you know, recruitment and how and the platforms and how this has evolved, right? So when I started recruitment 20 years ago, I was using what's known as an ATS, an applicant tracking system. So for example, any candidate that would have applied for a job or that we would have engaged with through our network or whatnot would have invariably landed in an ATS. And essentially an ATS is a database. And for anyone that's worked in recruitment or, you know, that maybe uses databases on an ongoing basis, I suppose the database is only as good as the availability of the data to access. And when we look back at, let's say, you know, recruitment databases, invariably, you know, most recruitment companies would use about 0.5 to 1% of the candidate pool within the databases itself, right? So essentially it's dead data, right? So it's just used to track candidates, sometimes to access the data there, but invariably it's worthless. So when we engaged with Elevate and I suppose had that strategic partnership, what it allowed us to do was actually to create more dynamic data. So first of all, what we did is we ran all our data through this AI platform. We engaged with the candidate pools that we had already created. We got all candidates to if they were agreeable to create new profiles on the data itself. And our candidates now can actually access this database and can actually update their profiles when required. So I suppose in its simplest form, what the platform can do is that when we put on a job specification onto it, we can dial up or dial down in terms of the requirements as dictated by the client, and the platform parses the job specification and comes back to us with a recommender list based on the talent pool that we have. We can identify then what good looks like, and then we can actually send out an automated message, a nudge as such, to our candidates in our talent pool to indicate to them that we have a job that's available here and if they're interested in it. And I suppose what this whole thing has done is actually, this solution has done is it's taken away the likes of Boolean search. It's fully automated our search and selection process. It's actually reduced our cost of time with regards to the whole search piece. But more importantly, what it has done is it actually has created, I suppose, given back more time to the consultants to actually have that kind of richer engagement that, you know, it gives an opportunity to allow the consultants to engage more with candidates, to get an understanding in terms more about their own background and experience. And it also gives an opportunity as well for our consultants to actually present the client opportunities in a far more detailed and richer way as well. So essentially what it does is it gives that engagement piece back to our consultants, and it's reduced our search time and our time spent searching, hunched over a laptop, creating these large, complex Boolean search strings. It's given it back about 30% of the consultant's time to actually engaging more with candidates, which is fantastic. And I suppose the end result of that is actually we have got better quality delivery to our clients, because the AI and the machine learning platform actually matches candidates better. It engages more efficiently with candidates as well, in the sense that we're actually presenting candidates with better jobs, better matched jobs as such, and it allows us to speed up delivery and quality delivery to our clients as well, which is all a good thing. In terms of the platform itself, the platform, I suppose, is fully automated end to end. So what it allows us to do, it actually allows us to post to, it says 750 job boards there. We've actually increased that to 1,500 globally. So what we can do is we can send to multitude of job boards globally. We can actually utilize, we can actually interrogate our own internal databases as well, and it speeds up our whole search and selection process then, and we can support permanent, contingent and statement of work type roles with it. So just in terms of, I suppose, the overall benefits of it, it reduces the time on Boolean search. I suppose for our own internal hiring, we can actually hire individuals now who don't necessarily have to have the required industry background to be able to support that industry, because we can train our consultants up on the use of the platform. And I suppose over time they get to appreciate and understand the technology market, etc. It really reduces our cost on job boards because we've less reliance on them now from a data mining perspective. It generates more value from our existing talent pool, in the sense that our data is now dynamic. We're engaging with our talent pool on an ongoing basis. You know, we're presenting them with valued opportunities. We're getting more engagement from our candidate pool because we're presenting them with better jobs and job opportunities as well. The very fact that, I suppose, the whole process is automated, it allows us to, it reduces time on search, so it gives more time back to our consultants to engage with candidates. Ultimately though, excuse me, it's a better fit to the client brief, and it allows greater delivery to our clients as well. And obviously our sole aim is to ensure that we have a happy client and obviously a happy candidate as well. And what that has done certainly has allowed us to do that. The one, I suppose, just to finish, this platform itself actually is continually updating. I think there's I'm not an AI or a data scientist, but I believe there's about 50 million data points within the platform itself, and it uses machine learning to continually learn, and in terms of new opportunities and new job roles that are out there. And we also regularly scrape some job boards and you know, online platforms as well, just to get an update in terms of the new job titles that are out there, because certainly from having worked in tech for 20 years, what technology is very good at is actually creating new job titles every 3 to 4 years. So certainly that machine keeps updating as well in terms of new roles and opportunities that are out there as well. So I suppose just to finish up, really, it's revolutionized in terms of how we approach our whole search and selection process. It provides far more efficiencies in terms of our day-to-day processes, and I suppose more importantly, it has increased our ability to have richer and more quality engagements with our clients and our candidates as well.
Great, thanks a million, Paddy. Another great example of AI complementing rather than just replacing humans. So fantastic. So our final panelist today is Kieran Towie from, he's the Applied Intelligence Lead at KPMG. So he'll be talking to us about cognitive computing, and I'll hand over to you now.
Thanks, Saul. So I think, yeah, brief introduction. I am a data scientist. So I think I built my, what you might call it, my first AI model nearly 20 years ago. So I've been in this business for a long time and seen the evolution. And I really think we're at a critical juncture in terms of that evolution. Most people are sort of vaguely and broadly aware of applications of AI because they see that on their phone, or they hear about it online, or experience it with, you know, Alexa in your home, whatever it might be. So you kind of vaguely know it's there, and possibly not exactly sure what it is. And as Barry was pointing out at the start, there's no universal definition, but it's definitely something got to do with technology, and something got to do with data, right? And I thought maybe what I would do is to spend a little bit of time explaining actually how the process works, right? Because I think what we've heard at the minute is specific applications, which are great, right? That's using AI in that infant space, in the HR space, whatever it might be. But, you know, if you want to translate AI into your own particular use case or business problem, it mightn't be as clear how that happens, right? So I like to start with a contrary quote that basically says, "We're the future and everyone else is doomed." So, you know, there's Mark Cuban basically just says, "Listen, this is such an important technology, so disruptive. Not everyone needs to be a data scientist, but you need to be aware of what it is, and particularly the capability." So as I said, right, I just give a little bit of how AI works, and I'll focus in an area that's probably more generally called cognitive computing, right? But most people, when they hear artificial intelligence, you go, well, you know, somehow it must be mimicking human intelligence, which isn't a bad place, you know, to start from. And if you actually ask how humans learn and make decisions, and then you can ask, well, how does the machine sort of learn and make decisions, and then how we can use that. So, you know, there's a sort of, I think, very simple diagram there in sort of 4 steps, right? The first one is sense, right? And when we say sense, we know we've got our 5 senses, right? Our sight, you can look and you actually see data about the world. You see, I could see, you know, the green wallpaper on the wall. I see my pictures hanging on the wall, right? So there's data and information coming into my brain, and that's processing it. But I have sensory capability. I can touch things, see things, taste things, right? And essentially, the technologies can look to emulate that ability to sense, right? We've got computer vision for self-driving cars, so you kind of go, you know, broadly speaking, we almost have technical eyes, right? But the key thing is you need to feed the system with data, right? With information that it could then process, right? So the assess part comes, well, okay, well, I need to weigh up the data. So take the examples have already been cited, right? From a HR perspective, you want to be able to say, well, listen, I'm feeding in, I think it's like 50 million CVs or data points. I'm feeding in information, but you want to know, well, you know, is this a good candidate or a bad candidate, or is this baby susceptible to brain injury or not susceptible to brain injury? So you provide the machine with, you know, keep it simple here, some definition of good and bad, and it goes, okay, I can see, with all this data, I can see what looks like good, and I can see what looks like bad, and then I can start to weigh that up and be able to discriminate between the two. And once you get to a certain point, then you make some sort of decision. So you act, maybe it's, you know, send this CV or intervene with this baby, and then once you've made that decision, see what the outcome is, and then feed that back and say, all right, this is what I thought. Feed that back in. Was I right? Was I wrong? So broadly, that's how the whole thing works, right? And this operates in very many different environments, right? And one I'm currently working on is what's called digital onboarding for banking applications. So if you want a new current account or mortgage or anything like that, typically now you can do that remotely. You used to have to go in to the bank, and they'd have to have a look at you, see that you are a real person, check your documentation, all of that, right? But now much of this can be done online. And what's actually happening is, you know, the first it'll usually ask you to take a photo of your passport, and you go take a photo of your passport. So actually in the background, what it's doing is AI going, well, is this a good passport or potential bad passport, or forgery, fake, been manipulated? And the way it's done that is the tool has been trained on, here are examples of good passports across all the countries in the world. So I can recognize, I don't know, a Sudanese passport, good one versus a bad one. The same way I could recognize an Irish good one versus a bad one. So it makes that comparison. You take a selfie photo of yourself, and you're going to go, here's me. And then AI in the background goes, well, this is the picture that he sent us. This is the picture that's on their passport. Is that the same person? And again, what it's actually doing is it has been tested across millions of situations where, you know, slight changes of your profile or across different times. And you said, well, we know here was a picture of Karen and here was a picture of Karen. So how many times do I get it right? How many times do I get it wrong? So AI always in the cognitive, what's called cognitive computing space, and I say cognitive computing because what I mean is mimicking human capabilities, essentially takes all this data, weighs up, makes decisions, and then feeds that back in. That's why it's called machine learning. You go, here's the result fed back in, and now I should update my sort of knowledge base and keep going. So you're probably mostly aware, anyone in technology would be mostly aware of RPA and sort of basic process automation, right? This is the way the world is going. This is why that there are sort of scare stories around the huge volumes of people that may be made unemployed. You know, we've got computer or self-driving cars. Therefore, you know, does that mean the end of logistics and drivers? You know, it certainly means a massive in your footsteps, right? Accountancy manipulating data is going to be completely automated in the future. So we're moving towards using AI to better mimic a human and humans' ability to make decisions. And I thought I'd take an example that's probably, you know, easily extensible into lots of other areas. But all of you that works in technology will probably be very familiar with being able to work with what's called structured data, right? So if it's in a database, if it's in Excel, you can do calculations, manipulations, and, you know, that's very much standard and almost universal skill set for technologists to be able to manipulate that kind of data. We generally find that, oh, we need humans to read emails, read documents, you know, look at social media, make sense out of a picture, make sense out of a video. What I'm saying is, you know, this is no longer the case, right? The AI and that cognitive computing capability very much can start to mimic how do you make sense, particularly out of documents. There's an area called NLP, natural language processing, that looks to actually understand the written language. You know, there's computer vision and sort of intelligent OCR that can make sense out of videos and images. And essentially that's been taught to these systems. You've been shown many examples, as I've said previously, many examples, and they don't have to be the same, but pick up the technology will pick up the features and then start to make sense out of it. So taking an example of what I would call visually rich documents, right? Almost all documents, if you think of letters, right, have some kind of inherent structure, right? They're usually, you've got, you know, maybe your address on the top right and dear sir or madam and whatever it is, but there's structure in documents that a human looking at it can make sense of. So if you even just look at the ones there, you can kind of go, okay, I can see the sort of a table in the second one that's obviously makes some sort of sense to me, that if I read horizontally, whatever's on that line, you know, is associated with whatever's in the box beside it. There, you know, there's certain structure here that we can make sense of. And there's a whole load of different applications that we can then say, well, how do we actually take out some of these mundane tasks where we've needed human eyes and brains to look at before? Project I've just completed was on what's just called remediation of mortgage documents. And essentially what mortgage documents were, you know, letters of loan offer. And you that's had a mortgage will have got a letter from the bank saying, dear Karen, we're going to loan you 200,000 at this interest rate, and et cetera, et cetera. You know, there's, gives you the information. Part of the whole process, you'd have had to get your house valued. A valuer would have said, oh, this house at this address is worth this amount of money. So we're able to use all that, that information that's in all of these documents and extract that information and pre-populate into a database, so that all that work that would have had to be done by humans now no longer has to be. So I'll give another particular example, just showing showing it on a mocked up invoice, and we're using this in also sort of what let's call is from purchase orders to invoices to transactions, right? To be able to match, right? I've ordered something, has it been delivered, partially delivered, is there a purchase order, has it been paid? So that reconciliation, again, it's just a process that takes accountants in particular a lot of time looking at different systems to try and work out, what the current situation might be at the end of the month. But if we look at an invoice, it's very clear there's a lot of structure here. We can see who's the bill to. Over on the right hand side, what's the invoice number, the PO. We can see what the actual products are: platinum web hosting, package, the quantity, the price, totals, right? All that information is there to a human that can make sense out of it. We built and deployed for 4 years, over the last 4 years, a solution that essentially can say, well, look, I can make sense of this, right? So if you look at the top one and go, well, that's the address, right? I know what the company is, what the address is. I know what the phone number is. I know what this invoice number is, which means now I can put that into a database and reconcile it with another system. I know what service has been delivered, for how much, for what total, or what individual prices, all of that information. So this whole reconciliation that one would need to do, we can automate vast amounts of this. And the whole thing is the invoice does not have to look like this exact structure all of the time. If we inverted all of these things, if we had the price and the amount on the left-hand side with the services on the other, we would still recognize that. Or if you had the same thing on bill 2 was down at the bottom, the whole point of the AI is it doesn't expect an exact fixed structure. It actually mimics the human being to be able to say, well, hold on, I know what I know I can see the structure in the document itself, and I'll use that to make the decision. So I think that these applications have huge, can be turned to so many other different use cases. And I'm certain that underlying, for example, the HR technology is doing something like this. It's looking at skills, it's looking at history, it's doing all of that, and then looking to match that to demand. For the infants, it's slightly different. You're saying, well, look, we've got examples of brain scans for thousands, maybe hundreds of thousands of babies. We know which ones had adverse outcomes and which ones are good outcomes. So it just keeps learning on the basis of that. But in those cases, right, the AI actually is proven to perform far better than humans. Actually, it's proven to perform better than humans in this situation as well, because on average, even the industry average is about, humans will make about 5% errors when transcribing information from A to B, and it's usually because we end up switching off ourselves. It's a boring, repetitive task. So actually, you can show that we're better able to, the machines are better able to perform in these kind of situations. So if I go back just a little bit, because I had another example, but I'm looking at time, so I think I'll stop and open it up for questions. But that the world is going to what I have down there, and that cognitive automation is being able to make sense of information that was previously the domain just of humans. But I don't see that as a threat at all, right? It's no more than with the advent of electricity or the diesel engine or combustion engine. It gives rise to a whole other variety of new industries and new applications, while taking away more of the mundane sort of less creative tasks, right? So part of this automation is actually we're going to free up the human to use their creative capabilities, I think, far more. And I know that might sound like the marketing of AI, but if you look at many of these different processes, they're usually manual, mundane tasks that, yes, you particularly require a human, but human being is really just a body in the process. They're not really using their abilities to the best that they could use them. So if we take away that and free up that capacity, I think it gives the opportunity to be far more sort of productive in the future, but also try and solve some of the much wider societal issues that we're going to find ourselves, that we are finding ourselves landed with, whether it be environmental or whatever. But I'll probably pause there just to make sure we give some time for questions. So thanks.
Thank you very much, Kieran. So we can certainly answer a few questions. I think, Paddy, there's one for you there in the Q&A box. Maybe you can address that from Gillian, who asks, talent attraction is obviously your passion and business, but any thoughts on AI opportunities for talent retention, most especially as the world experiences the Great Resignation reset?
Yeah, thanks. That's quite interesting. Yeah, actually, in some of the conversations we're having with particularly large enterprise clients that maybe would have large distributed workforces, part of the challenge that they have is around what's perceived as a glass ceiling internally. So individuals not seeing opportunities within their own organization to enhance or their career opportunities, or maybe move up the career ladder and whatnot. So we're increasingly seeing some HR systems that have increased AI capabilities around, I suppose, nudging people internally with regards to opportunities that are advertised internally within their organization to ensure that they can retain the best talent, and that they can actually present their own employees with additional career opportunities as they arise. So certainly it's AI is actually increasingly coming to the fore. There are a number of platforms out there that are actually being marketed, not just as internal kind of workforce management platforms, but also as internal career development platforms as well. So I think that's probably a way of addressing maybe the Great Resignation or reset as well, in terms of presenting opportunities to employees internally as they arise.
Great. Another question here from Helen Clark to all the panel. What would you see as the primary con and risks of more and more AI adoption? Anyone want to take that one?
What do you? What's the primary con? What does it?
I suppose, what are the main risks of more and more AI adoption?
Yeah, I guess it's important that these systems are what we call trustworthy, that they satisfy those basic ethical requirements, that they are legal and that they are robust, that they do what they say they're supposed to do, and this means slightly different things in different fields. Like I'm sure in Geraldine's application, if one was 90% accurate, that isn't good enough, because particularly if the 10% that you get wrong are those cases where there is a seizure and you do nothing. So we also have to be careful how we evaluate AI systems. So I think the big risk is that these systems are not built properly and that they're not trustworthy. And I think there's lots of things that we can do about that, obviously, and training and education and so on is really important. But I don't think we need to fear AI. This idea that AI is replacing jobs, it isn't proving to be true. So it's certainly changing work, but not replacing people at all. And that's because AI systems are typically very brittle. You do need a human in the loop or on the loop. You need a human there to understand. It's like, sorry to pick on Geraldine's example, but in Geraldine's example, she didn't say that the system takes its own decision. You know, it makes a recommendation. And obviously, there's a human being there then to figure out, well, do I act on that or not? And that's really, really important. That's what makes the system very reliable and trustworthy. And I think, you know, these are the kinds of aspects that will be challenging. Thanks.
Great. Well, we're at 9 o'clock, so I think we might just call it at that and let everyone back to their days and back to your days as well, of course. Thank you. Thanks Barry, Geraldine, Paddy, Kieran for your talks, really good. And thank you too to KPMG for sponsoring today's event. So yeah, have a great day, everyone.